Hi, Dr. Jim Jameson from Youngstown Orthopaedic Associates here today to talk with you about topics in joint replacement surgery. Today we're going to talk about the things that you need to do in the few weeks leading up to your surgery. I try to see every patient roughly 4 to 6 weeks prior to surgery for a preoperative visit. We talk about a lot of the things that you need to do to get ready for surgery, and these include seeing your medical doctor and your cardiologist if you have one for a preoperative medical evaluation and medical clearance. The most common medical issues that we need to be sure are under control include hypertension or high blood pressure, breathing problems, and diabetes. Patients who are diabetics need to have their sugars well controlled, and you need to know what your hemoglobin A1C level is. Hemoglobin A1C is a measure of the long-term care of your diabetic management, and your A1C needs to be less than 8 in order to have a joint replacement surgery. If your diabetes isn't under good control, it puts you at a higher risk of infection, and that can be a big problem with the joint replacement surgery. If you don't have a cardiologist and your medical doctor decides that you need to see one before surgery, we kind of need to get that arranged and make sure that's done ahead of time. That's why it's good to see you 4 to 6 weeks before your surgery, so we have time to get all these important things taken care of and that you're ready to go and all set for a successful recovery. Thanks very much. We'll be back next time for another discussion about joint replacement surgery.